Our family doctor. Indicators show that Sri Lanka performed well in the past. Our problems were mainly that of maternal and child health, communicable diseases such as diarrhea, malaria, filariasis, vaccine-preventable diseases such as poliomyelitis and measles. Our health system evolved and expanded to cater to these health problems. The community health services expanded and was largely able to contribute to good health outcomes. Today, the problems encountered are mainly chronic diseases such as non-communicable diseases, mainly diabetes, ischemic heart disease, hypertension, stroke, asthma, cancer, mental health issues, injury, and health challenges from aging. Let's consider the story of Nimal. Nimal has been having a headache for some time. He talks to his friend Raj about whom to consult. Raj recommends a brain doctor whom he has heard of in the teaching hospital. He bypasses the closest village hospital and goes to the big hospital. It's a long way off and he decides to take a trishaw. They think that hospital has more doctors, better medicines and better facilities. They reach the big hospital only to find that it is crowded. However, Nimal finds he has to wait in a long line in a crowded OPD to see a doctor. Others too had traveled long distances, spending time and money to travel to the big hospital, but not all were able to see the big doctor. The brain doctor does not find anything wrong with him, but Nimal is given some painkillers. Nimal does not feel well at all. His concerned aunt tells him to get his eyes checked. Nimal consults the eye doctor who says his vision is normal. But the headache doesn't get better. His boss at work says that he had similar symptoms with indigestion. He recommends that Nimal should consult his gastroenterologist, which he does. But here too the doctor finds nothing wrong with him. Similarly, Nimal goes to various doctors, but his problem continues. Nimal's story is a common one, although the context may vary. Nimal's problem turned out to be depression. If only he had a doctor who was familiar with his personal and family background. What needs to be done? People need a doctor closer to home in primary care. And they would also need appropriate referral to specialized care. PHC is essential care that we all need. These services should be within easy reach and should be affordable. Sri Lanka is well placed to give effective coverage of primary and specialized care considering the number and distribution of health institutions around the country. We must make use of this opportunity. The existing network of primary care curative hospitals known as divisional hospitals and primary medical care units need further strengthening to be developed into a state-led family doctor system, providing affordable primary care to the majority. What the reform is all about. Let's look at the reform in a little more detail. The reform is known as the Shared Care Cluster System. It is about reorganizing primary care facilities around their closest specialized hospital, which would be a base hospital, district general hospital, or a teaching hospital. There will be 122 such clusters with the present number of specialized institutions. For the primary curative facilities, DH and PMCU, this is what we expect. Primary curative, more doctors, availability of medicine, access to lab facilities, improved basic emergency care, a facelift for our patient facilities, better residential facilities for our doctors in rural areas, specialized hospitals, referral institutions, TH, PGH, DGH, and BH, accommodate referrals from primary care institutions, refer, support, and coordinate, personal health records, administration of cluster, coordinate, supervision, performance monitoring, capacity building. Better health outcomes reduce out-of-pocket expenditure. What does the future hold? This is the story of 58-year-old Ramani, who comes for her regular checkup to her family doctor at the primary medical care unit. The doctor greets Ramani. He looks through her personal health record and recommends that she gets her eyes checked for complications. He refers Ramani to the closest Apex hospital. He also recommends that her husband makes an appointment for lifestyle guidance at the Healthy Lifestyle Clinic. We want all stories to be like Ramani's, with a strong primary health care system supported by specialized care through the shared care cluster system. This is possible. A family doctor for all through the shared care cluster model. Reorganizing healthcare delivery system for better health outcomes. This reform is proposed to achieve universal health coverage, better health outcomes, and should be an integral part of our plan for sustainable development.